Well, thank you all so much for joining us tonight. This is our first ever public town hall event like this online, and we're excited that we had over 100 people register. So we're still having people trickle in. We have dozens of folks on YouTube Live, and I lost count how many people are on Zoom right now. It's so exciting to see all of your faces. My name is Liz Beatty-Owens. I'm the operations organizer at the Vermont Workers Center. And I'm really excited to be here tonight with all of you, especially in this moment of physical isolation, to be connected with so many people. I've been a part of the Vermont Workers Center since I was a child, coming to actions with my parents. And this time in our lives highlights now more than ever just how important our fight for universal healthcare has been. And so we're here tonight because we're not backing down. The Workers Center is 22 years old this year. It was started in 1998 by a group of low-income workers in central Vermont, and they began a grassroots organizing drive to improve the working conditions of people in their communities. And in 2008, we launched the Healthcare is a Human Right campaign, fighting for all people in Vermont to have access to publicly funded universal healthcare. We're a membership organization made up of poor and working class people across Vermont, fighting for economic justice and human dignity. And we're also a part of the Poor People's Campaign, National Call for Moral Revival, which is a continuation of the campaign started in part by Reverend Dr. Martin Luther King in 1968. I want to just take a quick moment before we dig in to give you a few logistics. We have a few facilitators tonight, and just to introduce them real quick, we've got Avery Book, who is currently the president of the Vermont Workers Center. He also heads our political education committee, which we refer to as POLE, the People's University of Learning and Liberation. And he's joining us from Thetford. We have Britta Fisher, who is also a part of our political education committee and on the Chittenden County Organizing Committee, and she's joining us from South Burlington. We have Griffin Shumway, who's on our coordinating committee, our base building committee, and a part of his local organizing committee in the Upper Valley, and he's joining us from Wilder. And we have Ellen Schwartz, who leads our campaign team. She's on our base building committee and active with the Windham County Organizing Committee, and she's joining us from Brattleboro. I'm calling in from Burlington, if you were wondering. And tonight we're going to share with you our analysis of this crisis and the road ahead for how we believe and how history has shown us we will organize our communities both here, nationally and internationally, to have a better world as a result of people uniting in a time of struggle. Before we begin, I'd like to make sure that everyone has had a chance to both sign our petition to expand Medicaid and keep our rural hospitals open. Through this crisis and beyond, I'm going to ask one of my co-conspirators here to put that link in the chat box, both for YouTube and Zoom. So if you haven't signed that petition, please sign it. We've had hundreds of people already sign on. And also to make sure that you're registered for this event. If you join us via YouTube Live, you might not be registered. We know that the most powerful way to create lasting change is to come together with united vision, and we can only do that if we know who's here with us. So we can continue to come together and stay connected for a more just world. And as we adapt to our new world of socializing through technology, we just wanted to share that because of technological limits, we invite you to use the chat box tonight to exchange ideas and ask questions throughout the event. We will try to answer questions if time allows. We do have chat monitors who will keep track of this, but we will also be hosting a series of smaller Get Involved meetings in the coming weeks and potentially months, also online, where there will be time and space for more thorough discussion. But in the meantime, we have folks muted just so that everyone can hear the individual speakers and facilitators. And so please feel free to use that chat box. Now, without further ado, I would like to pass it on to Avery Book, who is going to dig in with you all with our analysis of the crisis.
All right, thank you, Liz, and thank you, everyone. This is really exciting. I'm really encouraged by the way in which we're able to still come together and act collectively, even while we're being geographically distant. So if you give me just 1 second as I queue up computer. So we wanted to, as Liz said, we wanted to share our analysis to offer a deeper political, social, and historical context for how this crisis came about. this crisis that's both the healthcare pandemic, but also this economic crisis, which we'll hear more about after my part of the agenda. But in understanding this crisis, we want to start by acknowledging that most of us were already living in crisis before this pandemic. The pandemic and the resulting economic crisis are merely exposing cracks that were already in this broken system. And the system where workers are underpaid, families go hungry, and sick people are consistently unable to receive the care they need. And we've been living in this crisis of an unequal society that also teaches us to blame each other, to fight over crumbs, to fight over what's left behind by the powers that be, instead of coming together to change our circumstances. And we've already seen some of that in some of the federal legislation of this kind of who's deserving and who's undeserving, who's essential suddenly, even while they're underpaid. We see many, while most of us are told to stay home and take protective measures, essential workers, such including undocumented farm workers in our state, continue to go to work, and many of them are excluded from the kinds of protections that are needed in this moment. And this analysis that we've collectively come together is rooted in the fact, this basic understanding that we all have a right to live with dignity here in Vermont, in the US, and across the world. We need to transform our healthcare system and our society to meet everyone's needs through coming together and organizing to take social wealth back from the few who are hoarding it and put it to use for the common good, for the public good. So we have a few different sections. I'm going to be focusing mostly on what we're seeing sort of in the healthcare system, and then pass it over to Britta, who's going to talk a little bit more about the bigger economic context. The COVID-19 crisis is exposing some pretty horrific consequences that we're seeing of having a healthcare system organized to produce profit for a small number of global investors instead of prioritizing public health. As you know, part of this we're hearing from frontline healthcare workers here in our own states that they're running out of personal protective equipment. Some hospitals are even saying that they, even at the current level of patients, they might run out within the next couple of weeks. We know that the Vermont National Guard is in building surge areas across the state, due to the possibility that there won't be enough hospital beds to meet the crisis. And we know that hospitals are here and everywhere are scrambling to find enough ventilators for COVID-19 patients. So why do we have such a shortage in materials to respond effectively to this crisis? With a long history of our healthcare system being forced to run like a business instead of a public good, to turn profit for a few wealthy people instead of private care, we've been stripped of our healthcare system's ability to truly respond to this crisis. So I want to introduce one of our members who's going to share a couple of stories to illustrate some of what's going on in this this situation. I want to introduce Julie Brisson, a Vermont Worker Center member from St. Johnsbury, who's going to share a little bit about her experiences.
Can you hear me, Avery and everyone?
Yes, now you're,
okay.
Yeah.
All right. Good evening. In late 2015, I was in the step-down ICU at Dartmouth. I needed to have a CAT scan when the orderly that was bringing me told me we were taking a shortcut through the basement. There were hospital beds, machines, and baby cribs, those neonatal units, lining the walls. There were a couple dozen beds at least wrapped in plastic to my left. I asked him what were those doing there, and he told me that the bigwigs wanted them returned because they had too much equipment and it was expensive. They needed to watch the bottom line. Watch the bottom line? Is that why there's this critical ventilator and respirator shortage today? Were any of those machines a vent like the one I was on for 6 days, the machine that helped save my life so that I could be here talking to you tonight? Watch the bottom line. So when there's a crisis, there's a lag on essential supplies to keep essential workers and patients safe. One of the largest teaching hospitals in the region put out a public plea for masks and gloves to be donated by the public. There are inmates making protective gowns with plastic bags to put over scrubs. Community members making masks by hand. In the United States, with our current healthcare system, Dartmouth can't supply enough gowns, masks, and gloves for their staff. What's wrong, my brothers and sisters? Hospitals are supposed to serve the public good, not be run like a for-profit corporation. Hospital CEOs make millions to run their hospitals efficiently. If being efficient means choosing who lives and dies because of shortages, there's something broken in our system. I bet Dartmouth wishes they'd kept that additional equipment now. I sit with my doctor for 5 additional minutes going over which antibiotic I can take for a chronic condition due to limitations on my prescription drug plan. My doctor says you're allergic to those, we can't use them. Oh, this one works well. I say I can't take that now. He said it worked really well for you when you're in the hospital. I told him it's $200 a pill, $4,000 for 10 days, and I don't have Silver Blue Cross Blue Shield anymore. We found an old school antibiotic that's hardly used anymore that would cost me $6, but I'd have to take it for longer because it doesn't work as fast. Why should I have to take an antibiotic with a slower result because I can't afford the most effective one because the insurance industry doesn't value me? I have to do this because our healthcare system is broken. There are so many questions like, why is the new antibiotic $200 a pill? And why do some insurance plans allow it and others don't? As the Reverend Liz Theo Harris says, the American healthcare system is genocide. This COVID-19 crisis is highlighting the deficiencies, the disparities, and the ridiculousness of our healthcare system. People are starting to listen as this healthcare crisis impacts their daily lives. We've seen in the crisis that poor people are dying because of chronic conditions that come with poverty. Don't we deserve to live? If I get COVID-19, will this disabled 61-year-old with Medicare Part A only and hospital charity be sacrificed for a person with better insurance? Many have said insurance companies have started assigning values to our lives. Healthcare is a human right, not a luxury, not a way to make money. I don't want to die because I fall into this weird gap where I make too much on disability for Medicaid to pay for my Medicare Part B. Stop the insanity that's our healthcare system. I'll say it again, healthcare is a human right. Thank you.
Thank you, Julie. Powerful story and powerful words. And Julie's story here highlights these deep, unjust realities of this for-profit healthcare system on our communities and on people all over the state and all over this country. We're not prepared to respond adequately to this crisis because the bottom line for policymakers has been allowing business as usual to continue making a profit for investors, for hospitals, and for pharmaceutical companies. When hospitals have to focus on the bottom line, they're prioritizing elective procedures and treatments like MRIs instead of the healthcare we really need. And as Julie's story shows, hospitals all over have been reducing the overall number of beds so they can maximize the amount of billable patients that they can move through at a time. Here in Vermont, unfortunately, our policymakers have responded to this crisis, this pre-existing crisis in our healthcare system, by doubling down on privatization and handing control of our healthcare system to a private company called OneCare Vermont, a for-profit company run by UVMMC and Dartmouth Hitchcock Medical Center. This is at the same time that a lot of our smaller rural hospitals are struggling to stay afloat. When we wonder why our hospital systems don't have the supplies or beds to meet the needs of this crisis, we need to remember stories like Julie's and the priorities that got us here. And we also need to remember the other part of her story about this enormous price gouging that goes on in the pharmaceutical world, the long history of the pharmaceutical sector overcharging on medicines while we need to be healthy and focusing their research on where they can get the most profit, which tends to be these expensive designer drugs for wealthy consumers. There's real reason to worry that big pharma is licking its lips in this crisis and wants to make huge profits on being the one to come up with the COVID-19 vaccine or treatment, which would just mean huge insurmountable barriers in some of our cases with the costs that might come with that kind of monopoly patent. We need healthcare as a whole as truly public good and human right, and a publicly owned pharmaceutical sector that can meet our needs and not be driven by what makes the most profits. So I want to next pivot to the way in which this crisis has been a real reality check for how we value our elders, people with disabilities, and the care providers who support both. As we've seen, the elder care facilities here in Vermont have been the real epicenter of the COVID-19 crisis, where multiple elder care facilities have been really hit hard, both residents there and the staff there. This is unfortunately no accident. Aging populations have long been seen by global investors as a gold mine for profits. With care workers being predominantly women, they're often paid less than a livable wage and forced to work in unsafe staffing ratios in many of these care facilities. For example, Burlington Health and Rehab in the Burlington area, which has been a real epicenter of this outbreak, that's owned by Genesis, a for-profit chain of senior homes that takes advantage of the steady stream of Medicaid and Medicare funding that comes in for supporting elder care, while cutting corners and not prioritizing the health and safety of its essential workers or patients. On the flip side, we see that people with disabilities have been devalued, with years of public health dollars being diverted from funding their long-term care for people with disabilities toward younger, more able-bodied workers that corporations see as more productive and profitable. I mean, this comes back to what we were talking about at the beginning of a real divide and conquer, creating the sense of the deserving versus the undeserving poor. So I'd like to introduce some other members of our community, more worker center members. I would like to introduce Erica, Jess, and Dwayne, who live in East Haven, Vermont, and who are going to share their story and experience that speaks to this.
Hi, my name is Erica, and I've actually been a home care provider for 20 years. And this is Dwayne and Jessica, who both not only have developmental disabilities, but they have some long-term health issues that affect them too. Dwayne, you want to talk for a minute?
Yeah, because I'm a diabetic.
Yeah, and you need insulin and
I need
stuff.
insulin and take pills and all the other good crap.
And then Jessica, you want to talk about quickly what you have?
I have Addison's disease, which is an adrenal gland deficiency. I've had it since I was born. And that means I have a very poor immune system. So and I have to take a steroid, which I've taken most of my life. It's tough because I like to be out in the community and I can't be because I have to stay home because of my immune system. I'm used to being around people. I am a people person and I like to be around people and people like to be around me, but I can't be around them right now because of this virus that's going around.
So I'm gonna stop for a minute and explain a little bit more what it means to be a home care provider, because a lot of people don't necessarily know. The easiest way to explain it is basically I almost do adult foster care for 2 individuals with disabilities. They live in my house 24/7. I support them with all of their needs and anything that they need help with. Typically with this job, they have day programs where they go out, or every couple of weeks they'll have a weekend of respite so that all 3 of us can kind of recharge our batteries and get a break from each other. But right now with this going on, and because they have other health conditions that make them at a much higher risk, it's not, we're not able to do that because we all need to be safe and stay healthy. When things first started being talked about and we knew we'd be practicing physical distance, I started to menu plan and research ways to get stuff from stores without going in. I also started to call doctors and pharmacies to get waivers for their meds to be filled a few weeks earlier so they would have them on hand instead of having to go out in the community to get them again. As with everyone, this has put an emotional and mental stress on all 3 of us. Jess and Dwayne are truly part of my family. And I have a strong fear of being faced with limited ventilators if they do get the virus, and someone in their 30s without disabilities being chosen over them for medical care, even if they were the ones to be there first. The other fear that I have is with part of my job, if either of them go in the hospital for an extended amount of time, I'm expected to be there with them. But with this going on, they would actually, for their first time, be alone and having this fear of not knowing what's going on and everything and being completely alone. The other thing that is really stressful that we're trying to do is I'm trying to understand all the information coming in news reports and press conferences, and then I have to find a way to relay the information to them because they're sitting here listening to it too, and I need to educate them and respond and answer questions that they have and fears. The COVID-19 crisis has put me and my family's well-being in jeopardy as we physically isolate to protect Jess and Dwayne. We are doing this because we know that our current system, different people are valued more or less based on their status in society. This is not just and not acceptable. Everyone deserves access to care, and we must fight to prioritize the healthcare system so that we can meet everyone's human needs.
Yes, thank you to all three of you for sharing your stories. And you need to say it again and again. Everybody has got the right to live. Everybody's got the right to live. And I just want to name that some of our siblings in the disability rights community have really been keeping an eye on this. It's been really disturbing in this context of hospitals being low on essential resources, facing these impossibles or triage positions. We need to emphasize again and again that everybody has a right to live, and someone with a disability has just as much value and worth as someone who doesn't. So just wanted to continue along this this line of just we need to be fighting for a system that treats healthcare as a human right and not as a profit or loss on the healthcare balance sheet. It's not acceptable for elders and for people with disabilities to live in fear because they might not get the care they deserve because of a system that's not prepared to care for everyone. We must fight for a system that values care workers more than cutting corners for profits. Again, elders and people with disabilities deserve a life with dignity. And we have seen that the priorities of a for-profit industry rank people based on potential profits instead of treating all humans based on need. And connected to this particular piece of the issue, part of our demands that many of you have seen on our website speak to the need for a livable wage and personal protective equipment for care workers and for all essential workers in a healthcare system that truly meets everyone's needs. So to pivot now to health coverage, many of you have long been involved with the Worker Center, so you know they've long been fighting around this, around getting healthcare treated as a public good and financed publicly. And in this immediate crisis, we've seen our lawmakers in Montpelier take some important steps towards protecting our communities and containing the spread of COVID-19, but they still haven't taken the steps necessary to make healthcare affordable, whether for those who may become infected or for the many of us who can't even afford basic healthcare, basic medical care. And the disturbing thing about this whole context is that the insurance industry as a whole has threatened to balance the costs of this crisis on the backs of the poor and working class by raising rates by as high as 40% next year. And I don't know about you, but the rates seem to have gone up plenty high enough as it is. It's just at this point, it's just becoming clear that it's just morally unacceptable to allow this industry, which makes its money by preventing us from accessing our healthcare, to exist any longer. Back in 2011, almost 10 years ago, the people of Vermont fought for and won Act 48, moving Vermont toward a universal healthcare system. Here we are 9 years later, and policymakers have made no progress, often saying that there is no political will to finance universal healthcare. Translate that they don't want to tax the rich and their buddies who are funding a lot of their campaigns. is there no political will, or is it really about an unwillingness to confront the for-profit industry that is exploiting our health and well-being? And a lot of us remember this trajectory. Governor Shumlin, who went from when he was a Senate pro tem telling us that universal health care was a good idea to being politically impossible, to then running his gubernatorial campaign essentially on a universal health care platform, to then just 3 years after the passage of Act 48, caving in to the business interests of Vermont and saying that now was not the time for healthcare, even though 9 out of 10 Vermonters' income would have gone up under universal healthcare, and only the top 7% would have seen any increase in taxation. And so we know that lawmakers have the authority to expand public health care to everyone in Act 48. And it's just become clear now more than ever that the time to act is now. We need Medicaid for all, not just during this crisis, but beyond, so that all people in Vermont have access to the care they need and deserve. And I wanted to take this last moment to share this piece of art by Worker Center member Jess Morrison, which really does a great job of illustrating the ways in which the big corporations and global finance capital takes our healthcare and turns it into profits. So let me share this with you. So see here at the bottom, workers, patients, and then so-called insurance lives. And these are people receiving care, these are people providing care, these are all the people at public institutions putting in research to new cures for different diseases. And then we see all that, we see on the side, wealth trickling up. And we're drawing actually from this really beautiful book called Work to the Bone that we recommend you all read. But just this idea, like rather than like trickle down economics, actually the way it seems to work is that we make the wealth and it trickles up. So you see all that trickling up to the hospitals, the hospital executives. You see big pharma taking all that public research and turning it into big profits and monopoly patents. We can see the insurance companies, the device manufacturers, all trying to make a ton of money off of our healthcare. And then we see the big investors behind all that, all the banks, all the lenders, all the private equity firms that buy up and invest in and trade these on the market, making huge amounts of money. And this is no joke that global equity firms like the Carlyle Group talk about healthcare as a growth sector. And they talk about this fundamental thing about our ability to live and to survive as something that can make them lots of money. So just wanted to share this powerful piece of art that illustrates some of what we're talking about here. And I'll stop the screen share. So now I'll pivot it over to Britta to share us a little more about this bigger economic context.
Great, thanks, Avery. So we're now going to move into looking at what all of that means for our strategy and what the road ahead looks like. First, we want to acknowledge that we're moving into a deepening economic crisis. We've been talking about how the coronavirus has exposed this underlying crisis in our economic system. And the media is trying to present these as two different crises compounding each other. But it's important to understand how this is actually one crisis, caused because our economy is based on producing the most profit and sees supporting human life as inefficient or superfluous in the service of producing that profit. We can see this with folks who are out of work, struggling to pay rent, or people who are working without protections, facing working conditions where being classified as essential means making them expendable to this system that prioritizes producing profit. We know that capitalism is a system that tends towards crises, and we've known for a while that another depression was coming. The fact that it's here now is unexpected as of a few months ago, but we've been waiting for this because of the historical cycles of capitalism. It's easy to blame Trump for bungling the response to coronavirus, but through the response of the whole government, we can identify priorities of the state as a whole and tell who is running the show, who has the power. Politicians and corporate leaders are taking three main measures right now that give us a clue as to what it is about our economic system that led to the US having the largest number of cases in the world. First, the federal government is printing trillions of dollars to hand out to the world's banks and just gave a massive bailout to corporations affected by the crisis, like the airline industry, while giving relative crumbs for working people. Second, corporations like Amazon are forcing their workers to keep working through the crisis, even though that puts workers at a huge personal health risk. And third, cities, states, and the federal government have passed laws that temporarily expand access to housing, healthcare, unemployment, and income, and release folks from prison. And these steps towards a temporary social safety net are being given now that poor and working people could infect the rich, disrupt the economy, or foment a wider social revolution in response to the crisis. All three of these responses indicate that the reason the US has the most cases in the world is because our economy prioritizes the profits of investors and only values us as workers and not as human beings. In all of its responses, the state is working really hard to protect global finance. We want to hold the gravity of this situation and what it concretely means to be in a depression. Unemployment will continue to rise at an astronomical rate. Wages will drop significantly. Folks will struggle to feed their families. And existing axes of oppression will ensure that people of color, folks with disabilities, Indigenous communities, and women with marginalized identities, for example, will be the hardest hit. We also want to name that after the crisis, there will be a recovery, but that it won't be on our terms or to our benefit if we don't fight for it. Instead, it will be on our backs. We're already seeing more automation and more online commerce. Right now, because of who controls surplus profit, automation means the loss of wages and jobs, but that's a choice. There could be more free time and people could be paid more for their labor. But again, if we don't fight for it, it won't happen. Power is connected to choice. Those in power are actively choosing the responses that they take in this crisis, and there's always a choice. Adrienne Marie Brown and Ursula Le Guin talk about the world of racial capitalism that we live in as someone else's imagination, that people actively imagined and created the systems that we live in for a specific purpose. We're living in someone else's imagination right now, and we're going to have to fight to live in the world that we can imagine instead. In order to form a strategy and decide where we go from here, there are decades of history we can study to better understand the present moment and what's likely to come ahead. I want to lift up three moments in particular. The first is the Great Depression of the 1930s. During the Great Depression, millions of people were unemployed. Poor and working class people organized on a massive scale, with many calling for an end to capitalism and a different system to meet people's needs. President Roosevelt passed the New Deal, which took the edge off of people's suffering, but which ultimately saved capitalism and strengthened the power of corporations over our lives. The changes that took the edge off were concessions that the government made, and important rights were gained. But there were intentional carve-outs that divided people along racial lines, giving protection to some, but deliberately leaving others out. For example, there were no protections given to domestic and farm workers, the majority of whom were and are people of color, undocumented folks, and women. The second historical moment is the War on Poverty of the 1960s. In the 60s, there were massive uprisings led by poor Black folks in cities across the country, an anti-war movement against the Vietnam War, and the civil rights movement in the South. President Johnson responded with the War on Poverty, a set of reforms which similarly took the edge off of people suffering, but didn't change the power relationships between the rich and poor people in America. And many of the reforms were rolled back once the movement subsided. The third and final historical moment I want to lift up is our own fight for universal healthcare in 2011. 10 years ago, the Vermont Workers Center and our allies built a big movement in Vermont that caught politicians by surprise and forced them to pass Act 48, the nation's first universal healthcare law. On the eve of passing it, the legislature tried to exclude undocumented farm workers from the bill, but we were well organized enough to see this divide and conquer tactic for what it was and didn't allow the exclusion to pass. However, once corporations and wealthy people regrouped and the movement subsided, they were able to make sure that the law was never implemented, which is why we don't have universal healthcare in Vermont today. The concession of universal healthcare turned out to be temporary. So what can we learn from these moments? The first lesson is that our opponents have a set of weapons that we should study and understand. They are usually divide and conquer, pit people against one another by establishing a group as the enemy. This is a favorite strategy of Trump and right-wing leaders in India, Brazil, Hungary, and other countries. Often targets are refugees, immigrants, Arab Americans, and other groups. It also filters down to become part of popular consciousness, blaming a lack of access to healthcare and benefits on neighbors getting opioid treatment, those on disability, and folks incorrectly using food stamps, for example. Using a stick against one group of people allows the state to encourage people to blame groups across a line of division for the oppression, rather than looking at who's controlling the system. The second weapon that they use are Band-Aid concessions. To head off calls for more transformative change, they'll pass a reform that makes things a little bit better while shoring up the unjust system itself. Obamacare is a good example of this. This carrot approach gives just enough of a concession to take the edge off without causing a change in the power or profit structures. Often the two are combined. For example, the New Deal reforms we looked at earlier expanded labor rights, but excluded farm workers and domestic workers. The second lesson from these historical moments is that our strongest weapons are the permanent organization of the poor, unity across division, and political independence. To look at what that means concretely, it means getting organized so we can continue fighting and not just have a one-time protest. It means we need to prioritize organizing the bottom of society, those who are most hurting and impacted by the crisis. It means intentionally bringing poor folks together across lines of race, religion, geography, and other lines of division. And it means being independent from both political parties so that we can advance our own agenda and vision and aren't co-opted into being part of somebody else's agenda. The final lesson that I want to lift up is that history teaches us that in a crisis, our tasks are threefold. First, fight for the strongest possible emergency measures. Second, fight to make them permanent, so they're not taken away after the crisis. And third, use that fight to get permanently organized so that we can transform our economy to meet human needs and start living in our own imagination of what the world can look like. So the question is, how do we use all of this understanding to figure out what to do next? And I'll pass it to Griffin.
Thank you, Britta. That was great and very clear. Which someone also said in the chat. There's about 125 people watching right now, which is super, super exciting. Thank you all for coming. I just want to sort of remind folks, if you joined late or if you just forgot, you can ask questions in the chat. We'll probably have time to dig into them a little bit at the end. So if you want to do that, feel free. Yeah, so thank you. That stuff's pretty heavy. But I want to get into a little bit of like what it actually looks like to be organized. So Britta mentioned the system that we're living in, the system that's putting profit of the owning class before the needs of our communities. It's not natural, right? It's constructed. And every day the owners of big businesses, of hospitals, insurance companies, governors, the president, they're trying to keep the system going. They're actively fighting for this system. And we have a choice to make, right? We can either give in and live in the society that Erica and Julie and Avery and everyone has been talking about, this like really cruel and unjust world, or we can forge a new path, right? Rooted in solidarity and the fulfillment of all of our human rights, right? At the Worker Center, like we've made that choice, right? We're gonna come together to find a new direction forward. So what does that look like? So we're building a movement and an organization to bring folks together across the state. And that starts right here, that starts in this meeting. You know, it starts by talking to our neighbors, our friends, our family, saying, come with us, right? When we say organizing or building a movement, that's sort of the core of it. It's like joining together. But to be a little more concrete, I want to introduce two ideas. One is organizing and building power, right? And the other is studying and building leaders. To start with organizing and building power, what we know is that power comes from organization. Fundamentally, that means one, we bring folks together like we're doing tonight, and then working together in a coordinated fashion and moving in the same direction. So that even though we have members across the state, like Liz mentioned, Britta's in Burlington, Avery's in Thetford, Ellen's in Brattleboro, you know, we're all moving in the same direction, and we can all be part of the same campaign, the same organizing drive, the same strategy, and trust one another so that we know that we're moving together, right? To win our demands, we don't just need everybody on the same page mentally, we actually need to be having each other's back and committed to this one strategy, one set of goals, one movement, right? The second half of that, though, is building a movement, is studying and building leaders. Our opposition is smart, right? They've studied all the history, you know, they've gone to the best universities, they've hired people to work in think tanks, write policy, and we actually need to match their smarts with our own, right? But we need to do that in a coordinated fashion, meaning we need a shared analysis, a shared understanding of our goals. Britta talked about the various lessons we can learn in history. We also need to be studying the present, what our opposition is doing, what the economy looks like, how things are changing so we can prepare for this moment, right? And this process of study builds our membership. In order to lead the movement, we need a deep understanding of what we're doing, what's going on, how we're responding. Our strategy is only as good as our members' ability to understand it. We can't just assume that because you come to a meeting that you get whole of what we're doing. So we need to be thinking and working together over time to build a really strong and loving organization, right? Britta talked about these lessons, but I just sort of want to re-highlight them, right? In our process of study, we've learned sort of like three key things. The first is political independence, right? It's not enough to hang our hats on politicians or public thought leaders. We're studying because we want to be the leading voice in our community, and that means having our own understanding of the world and our own organizations so that we're not beholden to the funders or politicians or anyone that might want to stop us or divide us, right? Secondly, we have this phrase, organize the bottom to move the middle. And what that means is first, folks that are being affected by the healthcare crisis both know the ins and outs of it and have the greatest interest in dismantling it and building up a new system. And that because we're seeing like the bottom sort of falling out in our economy right now, we're gonna have a lot more people hurting in this moment. Having a dedicated leadership to direct this downwardly mobile middle class is really critical in these times. And then sort of to emphasize our fight against divide and conquer strategies, we frame our response to division as organizing across difference. This means a lot. It is a lot, but probably more than I can really get into now. But critically, it means that there is structural power that is often either used to sow division or to use that division to materially benefit those already in power. And what we need to do is actually unify across these lines of division in order to build a diverse working class movement, right? It's hard, it's messy, people have a lot of prejudices, but those prejudices are often produced by those in power in order to keep us up, right? Avery mentioned the book Work to the Bone. I'm reading it now. It's fascinating. It's just a history of division and division and division and division sown by the ruling class to divide us, right? And the only way to get across that is by building relationships and building an organization that we can use to be the tool to unify the class across divisions. Yeah. So given all this, I wanted to show a quick video of what this looks like in practice. Last May, we held a Medicaid march in Barrie. It's our second Medicaid march. Our first one was in St. Jay the year before, to demand the preservation and expansion of Medicaid, right? Hundreds of leaders came from across the state to participate, and it was a really momentous occasion. I'm gonna share my screen real quick.
Welcome everyone to Barrie. I've had the privilege of being the pastor here at the Presbyterian Church for a number of years. We're marching today because healthcare is a human right. We're going to go down to the stop sign to Main Street, take a left, and go down Main Street to City Hall Park.
And I'm a homeless person. Without my Medicaid, I would not be able to have my defibrillator checked every 3 months. And that is the reason why I fight for Medicaid.
Can I have all the teachers in the audience raise their hands right now?
We're going to try to get that for you all with the visual. Just give us one moment. It'll be a little more exciting that way, although, as someone said, someone could use your imagination, right?
Sorry about that.
Here we go.
Welcome everyone to Barrie. I've had the privilege of being the pastor here at the Presbyterian Church for a number of years. We're marching today because healthcare is a human right. We're going to go down to the stop sign to Main Street, take a left, and go down Main Street to City Hall Park.
All right. I'm not sure the video is going to work this time around, but
I'm so sorry about that.
it's okay. Anyone who's on our YouTube live right now can actually watch it on our YouTube account, and anyone else can follow the link in the email you got to go check it out after this. We definitely recommend it.
Yeah, it's really good, right? It's this powerful moment of hundreds of leaders coming across the state in Barrie to demand the preservation and expansion of Medicaid, right? In December, we started the first steps of planning this year's Medicaid March. And then the COVID crisis happened. So we are not intending to do a Medicaid March this year. But we are building what we're calling, and this is sort of the announcement of the Nonviolent Medicaid Army, right? Which is, which we're borrowing from in the late 1960s, Reverend Dr. Martin Luther King called for a multiracial nonviolent army of the poor as part of the original Poor People's Campaign. And our partners in Pennsylvania, some of whom are on tonight, thank you all for being on, in this same spirit have formed a nonviolent Medicaid army that is taking action there for Medicaid for all and against hospital closures. And we're following their lead by bringing this to Vermont, right? So what this means is that we've had this really, really hard meeting, but we have this moment to be part of something that's greater than ourselves, a way of getting into step, a way of moving together to build the leadership and permanent organization of the poor that Britta was talking about. And in just a second, Ellen will invite you to formally join the Nonviolent Medicaid Army. But I do hope you will come with us in this journey and in this struggle. Yeah, so with that note, I'm gonna pass it to Ellen.
Hi, everybody. So our strategy obviously leads to action. And as we've been discussing tonight, we're in the midst of both a public health crisis and at the same time, we're entering a recession that can and probably will plunge us into another Great Depression. As in the Depression of the 1930s, as Britta was talking about, we're in this situation because both our healthcare system and our economy are designed to profit the few and not to meet human needs. Especially in this time, we need to be there for each other. Holding on to each other and acting together is literally our only lifeline. As Britta said, in the midst of this crisis, we need to organize to win the strongest emergency measures, and to fight, we need to fight to make sure they're not taken away when the worst of the pandemic passes. And we need to build permanent organizations so we can change the unjust system at its roots. We know that when the immediate emergency passes, they're going to try to go back to normal and figure out ways to profit and balance the budget on the backs of poor and working class people. That's why we're organizing the Vermont Nonviolent Medicaid Army. In this crisis, thousands of people are newly enrolling in Medicaid, in addition to the third of us who were already receiving services through either Medicaid or Dr. Dinosaur. Add to that the people who are unfairly excluded from Medicaid, and we will be a force to be reckoned with. But to do that, we need to be organized. We have over 100 people here tonight between Zoom and YouTube. Imagine what we could do if each person here tonight reached out to neighbors to overcome fear and division, to prepare to challenge the powers that be when they come with cuts, hurdles, and exclusions to Medicaid, and to make sure that we can all get the care we need, including those of us who are undocumented. We're focusing the fight in this moment on 3 fronts. One is Medicaid for all. Healthcare is a human right, no barriers, no exclusions. Number 2 is to keep hospitals and clinics open. And the third one is to raise wages and provide personal protective equipment for frontline workers. So now's the time to grab a pen or pencil, because I'm about to tell you 4 things that you can do right now to move forward on those fronts. We have 1 petition and we have 3 dates to share with you. First, sign our petition. If you haven't yet done that, sign our petition calling on Governor Scott and the legislature to move forward on all these fronts by expanding Medicaid to cover everyone in Vermont, keeping our hospitals and clinics open, and raising wages and providing personal protective equipment for all frontline workers. After you sign, share the petition with friends and family. The link is going to get shared in the chat, and you can also find it on our website, which is www.workerscenter.org. Second, tomorrow, make a call. Our allies at AFT Vermont, which represents 2,600 unionized healthcare workers in Vermont, they have an urgent demand for personal protective equipment. Please call Governor Scott, and this will also be in the chat, the numbers, at 802-828-3333, or email him at governor.vermont.gov/email to demand that he take immediate measures to provide PPE for Vermont's healthcare workers. This information is in the chat, and you can also find it at vt.aft.org. Number 3, the next day is a week from today, April 14th. We're asking everybody who supports our petition demands to call and leave a message for the governor, urging him to act quickly on all of these fronts. And number 4, on April 16th and 20th, we'll be holding regional meetings that you'll be able to join online or by phone. At those meetings, you'll be able to share your own experiences, find out all the ways that you can be involved in the Healthcare as a Human Right campaign and in joining the Nonviolent Medicaid Army. If you registered for this call, you'll be getting more details about the April 14th call-in day and the regional meetings, so stay tuned and make sure that we have your contact information. Finally, May 1st is International Workers' Day, so put that date on your calendar. This year, taking the lead from our allies in migrant justice, the Farm Workers Organization, we're taking their lead to support essential workers in Vermont, including our farm workers. And you'll be hearing more from us about the details of May Day. I know that we can't all hear each other now, and that we're also physically distancing, but we are all in this fight together. So let's chant in unity wherever we are. Forward together, not one step back. Forward together, not one step back. Forward together, not one step back. It's great to see all the mouths moving, even though I can't hear you. I'm going to pass it off to Liz to close us out for the evening.
All right, we're actually going to come back at you real quick and try to show this video. We're all learning rapidly in this new reality we're living in. So I'm going to have Avery screen share with you all, and we should have some success this time, hopefully.
Muting. Step at a time.
Welcome everyone to Barrie. Had the privilege of being the pastor here at the Presbyterian Church for a number of years. We're marching today because healthcare is a human right. We're going to go down to the stop sign to Main Street, take a left, and go down Main Street to City Hall Park.
My name is Lori Demers, and I'm a homeless person. Without my Medicaid, I would not be able to have my defibrillator checked every 3 months. And that is the reason why I fight for Medicaid.
Can I have all the teachers in the audience raise their hands right now?
I've had a long, lengthy battle with cancer, in which I heavily relied on the Medicaid system.
Mi nombre es Miguel, soy trabajador de la industria lechera del estado de Vermont, soy parte de la comunidad y parte de Justicia Inmigrante.
I wouldn't be able to afford my anti-diabetic medication or anything else if it wasn't for Medicaid.
Having to choose between basic staples of living, health, and psychiatric care is a tightrope that no one should be forced to walk.
We're going to fight for our right to housing, to food, to clean air and water and dignified work.
There's 140 million people in America who live below the poverty level. If we band together, we let them know we're not going to be silent anymore, that we deserve to live and we deserve to have a decent life. That's not too much to ask for with all the money that this country has.
Awesome. Well, we are going to just close it out real quick. I saw a request from the YouTube chat to reiterate the dates, and I believe those are the dates that Ellen shared earlier. So we have a request to make the call tomorrow to support our allies at AFT Vermont, and that's a call to Governor Scott at 802-828-3333, or to email him at governor.vermont.gov/email, and to demand he takes immediate measures to provide PPE for Vermont's healthcare workers. That's been pasted into the chat, but we can probably do that again. The next date is a week from today, April 14th. Everyone who supports our petition demands, we're asking you to call and leave a message for the governor, urging him to act quickly on all three of those fronts. And then April 16th and 20th, we'll be holding those regional meetings that Griffin just referenced again. So we definitely hope you can join us for that. Looks like Ben chatted that information. This has been amazing. It's our first real attempt at anything like this. So thank you all so much for joining us. We were doing some counts and we had at least 135 people join us tonight from all over the state and also from outside of the state too. And that is just so cool. I'm so inspired. And in a moment when and so many of us are alone or relatively isolated, physically isolated, it's just really moving to be in a space with all of these amazing movers and thinkers and people who are motivated to really move down the path of systemic change. So thank you. You helped us make worker-centered history. We want to just leave you tonight with one last grounding. This is a quote from Reverend Dr. Martin Luther King Jr. We'll play it for you in just a minute, hoping that all of our tech stuff works out. This is an excerpt from a planning meeting for the original Poor People's Campaign in 1968 with representatives from poor, Black, white, Hispanic, and American Indian organizations preparing for the Resurrection City encampment and Poor People's Campaign rather Poor People's March on Washington. This next voice you're about to hear is actually a recording of Martin Luther King.
Power for poor people will really mean having the ability, the togetherness, the assertiveness, and the aggressiveness to make the power structure of this nation say yes when they may be desirous of saying no.
So yeah, just like King said in 1968, having the ability, togetherness, assertiveness, and aggressiveness to make the power structures say yes when they desire to say no, that's our work. And that is what we will continue to do as we fight for our human rights. And we really hope you'll join us in one of our many upcoming on the line events, and eventually when it's safe to do so in person. And so until then, stay safe, stay healthy, and we're really looking forward to connecting with you as we build this movement. So thank you all so much and have an amazing night.
Thanks, everyone.